Hi, my name is Lucia Novak and I'm a nurse practitioner, and I'm here today at Meds in Orlando, and I'd like to give you some pointers on addressing steroid-induced hyperglycemia in patients who already have type 2 diabetes. So when we're looking at addressing blood sugars, we're always looking at patterns of the blood sugar as well as patterns of the medications that we use to address it. So with steroid-induced hyperglycemia, the most commonly prescribed steroid is probably going to be your prednisone, which is a short-acting steroid. I recommend that that steroid be dosed in the morning as early as possible, preferably before 9 a.m. We don't want the steroid to impact going into the night and impacting the patient's ability to sleep as well. So they're taking their prednisone. What you're going to see is within an hour of taking the prednisone, the blood sugars start to rise, and then they continue to rise in a stepwise fashion through the day, climaxing right around dinner time, if not bedtime. But then overnight, the blood sugars naturally start to come back down as the steroid effect wears off, rendering their morning blood sugars either to be at their typical baseline or a little lower. So patients that are only testing in the morning might only see this blood sugar in the morning being normal and not really realizing the impact of the steroid later in the day. When we look at insulin in patients with type 2, if this patient was not already on insulin, the natural inclination is to start a basal insulin. And with steroid-induced hyperglycemia, we have to be mindful of the pattern of the profile of the insulin. So your typical basal insulins, your Levemirs, your Glargine, even the newer products, the U300 Glargine or the Degludec, are very flat insulin and they impact fasting. So when a patient that is on a steroid like prednisone, their fasting blood sugars are not what typically needs to be addressed. So adding a basal insulin such as those might actually render the patient hypoglycemic overnight when the blood sugars are naturally coming back down, and yet not address the hyperglycemia that the patient is experiencing during the day. So the better insulin that has a profile that matches the pattern of the glucose that we see as a result of the steroid is actually NPH insulin. And so I use NPH insulin to address steroid-induced hyperglycemia when that steroid is prednisone. I have the patients take that dose at the same time that they take their prednisone in the morning, and I know that the profile of the insulin and the pattern of the hyperglycemia will match and will not render hypoglycemia overnight because the NPH is not as long acting as some of the other basal insulins. So that is a neat way for you to keep in mind on how to address steroid-induced hyperglycemia for your patients with type 2 diabetes.